Hi, my name is Megan Naccarato and I'm a D1 at Roseman University. I did a project with Ayushi Shah, Hannah Chris, and Dr. Man Hung. Our topic was the limitations of clear aligner therapy in mixed dentition. We did a scoping review. Clear aligner therapy, or CAT, is increasingly becoming popular in children due to aesthetic and hygiene advantages. Parents are choosing this option over traditional braces or even fixed appliance. In mixed dentition, erupting teeth and changing occlusion introduce biomechanical changes that may not be present in permanent dentition. These challenges reduce movement predictability, especially during transverse expansion. Current evidence suggests expansion is often achieved through dentoalveolar tipping rather than bodily movement that we would want. Posterior efficiency also appears reduced in mixed dentition cases. The objective of our study was to review current evidence on the limitations of clear aligner therapy in mixed dentition. Our emphasis is going to be on arch expansion predictability, biomechanical behavior, and treatment outcomes. This is especially interesting to me, and I was grateful that it was interesting to my team as well, because I have an interest in possibly specializing in orthodontics, and I really want parents to have all of the information, the pros, the cons, the risks, before choosing a treatment option for their child. The methods that we used, we searched 4 databases with a combination of mixed dentition and either clear aligners, Invisalign, or removable appliances, and a combination of the words complications, limitations, failure, challenges, or compliance. We really cast a broad net in our search strategy. The inclusion criteria for our research were articles written in English. It must be a mixed dentition sample, and it had to have a clinical or a biomechanical outcome of clear aligners. The exclusion were adult-only samples, articles older than 10 years, or non-outcome studies like editorials or reviews. Because we cast such a large net in our search strategy, we did have an initial record of 254 articles. Unfortunately, most of those were unrelated, and our final studies included after screening and assessing them for eligibility were 4. Across these 4 studies, clear aligners produced measurable transverse increases. The majority of the articles said that expansion was primarily achieved through dentoalveolar effects. Cuspal expansion was more predictable than gingival expansion as well. This suggests a tendency towards tipping dominant movement instead of bodily movement. Biomechanical modeling suggests reduced posterior expansion efficiency in mixed dentition, and in mixed dentition crossbite comparison, aligner therapy required longer treatment duration than alternative appliances such as traditional braces. Overall findings suggest variable predictability and limited root control during expansion. In conclusion, clear aligners can produce transverse dental changes in mixed dentition. However, predictability and biomechanical control appear limited, especially in the posterior regions. What this means for parents or for anybody who is considering doing clear aligner therapy in mixed dentition is that careful case selection is necessary, especially with their orthodontist. Further controlled studies are needed to define the role of aligners in early orthodontic treatment. For the future directions, further prospective clinical studies are definitely needed to evaluate the effectiveness and limitation of clear aligners in mixed dentitions. Having only 4 final included articles leads us to the conclusion that much more research is necessary. We really want parents to be making the best clinical outcomes for their children, knowing all of the risks and not just the benefits of possible hygiene or aesthetic options. For the future direction of research, we really hope that they focus on standardized outcome measures, as well as evaluating long-term stability of expansion and alignment. I would like to thank CORE for the resources and support that they gave us during this study and ongoing, especially Christy and Sydney. I want to thank Dr. Man Hung for all of her guidance and everything that she does for us. And I would also like to thank Ayushi Shah and Hannah Chris and their help for getting this project going and keeping it going when things got tough. Thank you.